Face and neck treatment. Remove makeup and wash face and neck area. Place marking paper on cheeks, jaw, and forehead. Apply alcohol on the papers and remove them after 2 to 3 seconds. Do the same on eyes and neck. Remember to avoid throat and aorta. Apply gel evenly on face, eyes, and neck with the thickness of a coin. Install neck probe on the handle and operate on marking cubes of the neck accordingly. Step on each cube 3 to 5 times. Make sure the probe is in full contact with the skin. Switch to face probe and operate on marking cubes accordingly. Stamp on each cube 3 to 5 times. Cover cheek, nose ring, and forehead. Switch to eye probe and operate on eyes. Operate on marking cubes accordingly. Stamp on each cube 3 to 5 times. Follow up with coat hammer operation. Move the probe in circles on neck. Move from neck to face in circular and linear lines. Move horizontally in circles on forehead. Scrape off the rest of the gel with mask spatula. Clean face, eyes, and neck. Apply eye, face, and neck mask all at the same time. Take them off after 15 minutes and clean the whole face and neck area.